Right, here we go. Okay. So the purpose of these videos... Hi, my name is David Collins, and the purpose of these videos are for the family members or people that are considering coming into treatment. And we start off with what I'm going to do is I'm going to talk through the treatment process and what happens. I'm going to start with a culture of learning. Culture of learning. So the word clinic comes from French. It means place of bedside learning, and what we want our clients to understand and to learn about you as family members as well is about a culture of recovery. Because you will all know about the culture of addiction. And what happens is, for our clients and for yourselves, you would have, there's the Hardy-Dars in the background, you would have learned about your loved one as they progressed along through life, from being born, whatever, and as their addiction progressed and they moved from a place of normal use. Most people use a substance or a behavior, a process addiction, love addiction, sex addiction, porn addiction, food addiction, to one that is more addictive, to say gambling addiction, drug addiction, alcohol addiction, and they've gone from use to misuse to abuse to dependence, and that they need treatment. And that's what we do here at our facility. We provide treatment. And the people that look for the treatment generally are the family members. So it's usually you guys that are looking for the treatment options for your loved one that is caught in a culture of addiction. So these videos are about you, about what happens, what to look for in a treatment center, and what happens to your client or to your loved one, our clients, when they come in and they start the process of moving to a culture of recovery. So the first thing is, when you're looking into a treatment center, first of all, check, is it registered? Is it registered with the local authorities? Is it registered with the Department of Health, Department of Social Development, or whatever it is within your country, whether it's, are they a registered, licensed treatment facility? And are they covered by insurance? If they are, then you can assume that they are treating this in a professional way, and that the care that your client, your loved one, is going to get is based in the medical model and isn't going to be coming from the moral space. Yeah. So we're trying to, first of all, teach the family members that their loved one is sick and needs medical treatment, and to get over the moral issue of feeling guilt and shame that the family members have been impacted by. And what we are interested in is, once a client comes in for treatment, is to move them towards the wellness model. So that our clients, once they've been diagnosed, that they can then move on to the wellness model and take responsibility for their medical condition, just like they would any other illness, whether it be diabetes or something. And you, as the family member, you are able to provide support for that client, but also to move yourself into a culture of recovery yourself. So you, the family member, whether you're a parent and this is your child, or whether you're a husband and this is your wife, or whether you're a wife and this is your husband, or if this is a brother, a sibling, or someone, their behavior would have impacted the family system. So let's just add some additional family members here. And each family member in this system is going to be impacted by their behavior. And their behavior is going to have an impact on the system. Now, you that's watching this video, the first thing that you need to start to do is to work on yourself, is to educate yourself about what a culture of recovery is for you. And what we're trying to get you to do, the first goal for you to do is to detach. Detach from the process. This isn't my illness. I don't have the illness. However, my love for this person is impacting me. So how can I detach? How can I still love that person while I'm watching them either deteriorate into the madness, deeper into the dependency, or how can I support them and love them as they start to take responsibility for their condition and they start to move into the wellness model, they start to move away from the medical side of things. I've taken responsibility for my biology, the dependence of physical dependence to the substance or the behavior, the psychology. I've taken responsibility for what I've learned, and I've learned how to socialize. Okay, it's called the biopsychosocial model that we want our clients to learn about as they come in for treatment. And you as a family member, we want you to detach. However, detaching means that we still want you involved in the process of treatment. Yeah? So we don't want you to just come and dump your loved one in a treatment facility and then to back off. We want you involved in the process. What we want to be curious, what we are curious about is how their behavior has impacted you guys as a family. Now, different members of the family are going to have different feelings. If it's your child here and you're the parent, you might be carrying guilt and shame. You might be thinking that it's your fault. If you're a sibling, you might be really angry at the person, your brother or your sister. Or you might be really fearful that they're going to come back and they're going to bring the chaos of their using back into the family system. So what we're trying to do is to get all the family members to start to come across and to move into a place of detachment for themselves so that they can start their own recovery process, because they would have been impacted. So you can imagine as someone's kind of growing up and getting older and the family unit grows and this behavior starts to happen, systemically the whole system gets impacted. And we want to work on the individual. We start them on their process. It starts with an assessment. First of all, what is their willingness for treatment? Do they want treatment? That is called pre-contemplation. I'm not even considering treatment. My family all think I've got a problem. I don't have a problem. They're all mad. I'm not interested. As the consequences start to increase, as the family members have started to detach, the client here might start to contemplate treatment. They might start to think, well, maybe what they're telling me is right. Maybe I do need help. Yes, I do need help. Then we start to move to action and then preparation, to prepare the person for treatment, and then action, and then treatment happens. And then they'll come in here and then they'll receive the treatment. They'll get their biology sorted out, they'll get the psychology, they're given workbooks, they're given a program. Our program lasts over time. Yeah. And as time progresses, our clients and you, your family members, learn more and more and more about the culture of recovery. You learn more about living in the solution and protecting yourselves from the problem. And this is where things start to get interesting. Because what's happened is the whole family has learned how to survive in a culture of addiction, and this is how we function. So the whole family system might hold this person accountable for all the dysfunction that's happening within the family. And the belief is when this person gets well, we're going to live happily ever after. Unfortunately, what happens is this person often moves to a culture of recovery, and the whole family system is now in a culture of recovery, and then the real dysfunction starts to rise up to the surface. So the whole family will need time to learn how to re-socialize and reintegrate and how to fulfill their various roles. Now, what we want you guys to understand here as a family is that recovery is a process. It's not an event, and there are multiple pathways to recovery. So I'm going to carry on with that in the next video, but that's the overall picture. We want to orientate you to the process. We want to get you orientated to the environment, and what we're focusing on is a culture of recovery, getting the client, the patient, to take responsibility for their wellness. While they're in treatment, if they're really resistant to treatment, we as a facility have evidence that we can then show you guys as a family is this person doesn't really want to engage in the recovery process, or this person really is engaging in the recovery process, and that change is starting to happen within the family system. So that's where we'll leave it here. Cut.